Concussions and kids' mental health. A new study shows there could be a link between the two. In today's Your Healthy Family, the director of a concussion clinic says there are some things parents can look out for.
Some of the primary symptoms after a concussion can include things like changes in mood, anxious thoughts, changes in behavior, irritability, that sort of thing.
A Canadian study published in JAMA Network Open looked through records between 2010 and 2020 of kids ages 5 to 18 who had a concussion or orthopedic injury. None had a mental health diagnosis before being hurt. Researchers found kids who had a concussion had a 40% increased risk of developing a mental health issue compared to kids in the same age and sex with an orthopedic injury. Children with concussions also had an increased risk of self-harm and psychiatric hospitalization. Kelly McNally, the co-director of the Complex Concussion Clinic at Nationwide Children's Hospital, says parents should be aware.
I think a primary thing for parents to do is just to keep that conversation rolling with their children. So if they have had an injury, ask them, how are they feeling? How are they doing emotionally? How are they coping?
If you notice red flags like changes in mood, being withdrawn, or not enjoying activities they once did, she says get help.
We don't want parents to be afraid for their children to play sports, but it does provide information to parents to help empower them to help get the right help for their children if they are seeing mental health symptoms after something like a concussion.
Now, the Centers for Disease Control and Prevention says close to 7% of kids 17 and under have had symptoms of a concussion or brain injury. With today's Your Healthy Family, I'm Lisa Greenberg. And for more health stories, head to fox4now.com/yourhealthyfamily.